Okay, ladies and gentlemen, we are going to continue our careers PowerPoints on mortuary and nursing careers. So, a funeral director, sometimes they're called morticians, undertakers. Those are old terms that we don't really use that much anymore, but you may see them on a test or something. So funeral directors direct funerals. They provide support to the survivor of the deceased person. They talk with that family to plan that funeral, to make arrangements as the family wishes. They prepare the body following legal requirements. There are a lot of legal requirements that are involved in a burial. They file for a legal death certificate for each individual, and they direct the business affairs of the funeral home. So an embalmer is actually someone that prepares the body for interment. Now, interment means burial. Okay, so they prepare that person's body for burial. They wash the body with a germicidal soap, and the embalming process itself actually takes the blood out of that patient's body and replaces that with an embalming fluid. And that embalming fluid is kind of serves as a preservative to allow that person to, be viewed and visited by their family and then to be buried, okay? That embalmer also will apply cosmetics. They'll put makeup on that person to create a natural appearance. If patients have bruises or, scars or something from maybe an automobile accident that they passed away from, they'll try to make those as minimal as possible so families don't have to see that. They also dress the body in whatever the family chooses for that deceased person to be dressed in. And a big part of it is maintaining embalming records because embalming chemicals could be very dangerous. So we have to be very careful with those fluids, and proper records have to be maintained. Now, hand washing is the single most important means of preventing the spread of infection. And with the COVID-19 right now, you guys, the best thing that you can do is wash your hands, okay? Wear a mask, wait 6 feet apart, and wash your hands, those 3 W's. This says glow germ activity, but of course we can't do that because you're not here, but we'll do that once you come back, okay? Now, nursing. Nursing is a big career in our state. Nursing has the power to make a difference. North Carolina is first in a lot for nursing, and we'll go over that. So, if you look at our license tags in North Carolina, we're first in flight, but we're also first in nursing because North Carolina was the first to pass the Nurse Practice Act back in 1903. We were also the first to establish a board of nursing, like each state has a board of nursing that governs the nursing profession in that state, and we're the first state to establish that board of nursing back in 1903. We also were the first state to issue a registered nurse license. It was in Craven County, which is New Bern, and her name was Josephine Burton. In 1911, we were the first state to establish a county health department. In 1989, we were the first to establish a nurse scholars program, and in 1990, we were the first and only to provide an institute for nursing excellence. So about 1 in every 70 people in North Carolina is a nurse. That statistic may not be correct. I tried to find an updated statistic, and I couldn't find anything newer. So we're going to go with the old material, which is 1 in every 70 people in North Carolina is a nurse. And each one of you know a nurse because I'm a nurse. And I'm sure you have people in your neighborhood, in your family, in your church family that are nurses. So in North Carolina, we can have what's called a licensed practical nurse. That's an LPN. And we can have a registered nurse, RN. So when it says right here in this PowerPoint, over 21,000 licensed LPNs and over 14,000 LPNs in the workforce. Now, there's that big difference in those numbers, and I'll go over that. Same thing with registered nurses. There are 85 licensed and 85,000, and 58,000 in the workforce. So if you think about, like myself, I'm a registered nurse. I hold a registered nurse license, but I am not in the nursing workforce because I do not work full-time as a nurse. I work full-time as a teacher. Now, I work part-time or supplemental pool, like as needed as a nurse at our local hospital in Kenansville, but I'm not a full-time nurse. I'm a full-time teacher. So I'm in that, the number where it says over 85,000 are licensed. I'm in that number, but I'm not in the 58,000 in the workforce, okay? Do you understand what I'm saying? So I'm a licensed nurse, but I'm not in the workforce as a full-time nurse. So there's the difference in those numbers, okay? Don't let those get you confused. So there are several different types of nurses. We can have an advanced practice registered nurse. You might see APRN. And under that category of advanced practice, which means I've had more practice, I've gone to more schooling, is your nurse midwife, which they deliver babies, a nurse practitioner, a certified registered nurse, anesthetist, or a clinical specialist. So those are a more advanced degree than a registered nurse, okay? So nursing is a knowledge-intensive profession. We do lots of critical thinking. We have high acuity level patients. We do a lot of problem solving. The point of what we're trying to do is create shorter stays lengthwise in the hospital for our patients. Autonomous decision making, meaning I make, as a nurse, a lot of decisions on my own in the clinical setting, okay? So a lifetime of variety. There's tons of work settings, age groups, and specialties that you can go into as a nurse. This is just a list of areas that you can work in: a hospital, nursing home, clinics or private offices. Private homes, you can do private duty nursing. You can work in the public health department system. You can work in schools. You can work in colleges. You can work for home health care agencies, hospice agencies, urgent care centers, rehabilitation centers, mental health centers, industries, somewhere like Guilford East or House of Rayford, somewhere that employs a lot of people. And you can also be in the military and be a nurse. There are tons of varieties or different areas of practice for nursing. Med-surg, which is medical, like I'm sick with pneumonia or COVID or whatever. Surgical, just what it says: surgery, emergency room, operating room, obstetrics and gynecology. Orthopedics, which is like broken bones and bone surgeries. Critical care, pediatrics, psychiatry, rehab, dialysis. You can go into any of these areas. Flight nurse and transport. You can work with any age population as a nurse, newborns to geriatric patients, which are our older adults. Okay, there are a variety of career entry points. You can actually start off in nursing as a nurse aide or a nursing assistant. You can be an LPN, which is licensed practical nurse. You may see it written somewhere as LV, like void. LVN, like licensed vocational nurse. That's an old term that we don't use anymore, but you may see that written somewhere. And that's usually a 1-year program at a community college. You can do registered nurse, which is a minimum of a 2-year degree at a community college, but now most people are getting their bachelor's degree in nursing. And you can go into the advanced practice nurse. So what we just talked about, some educational requirements for a registered nurse. You can do an associate degree in nursing, which is a community college. It's a 2-year degree. You can do a bachelor's degree in nursing, which is at a 4-year university, and of course it takes 4 years. And you can advance to master's or doctorate degree, and usually that's an online program, and it's 1 to 2 years after your bachelor's. It says 4 years, but 1 to 2 normally. Okay. Opportunities for career progression. You can start out as a nurse aide. And these, I just looked these salaries up, so they are accurate as for the most recent on the Bureau of Labor Statistics. So you go from $29,000 all the way up to $174,000, and you see that the salary increases with your level of education. And that just makes sense, guys. The more education you have, the more money you're going to make. Typically, okay, that is typically. We are autonomous practitioners, meaning we do a lot of decision making on our own. We have a lot of assessment skills. Nurses are the eyes and ears of healthcare. That doctor or provider is not with that patient at that hospital 24 hours a day, but that nurse is. So she sees changes in that patient that are progressive changes, and she can document that and make that doctor aware of that, okay? So that RN plans patient care. They make decisions about treatment regimens. Nurse practitioners can actually diagnose disease and illnesses, and nurse practitioners can prescribe medicines just like your doctor can. So, new nurse roles, we can have advanced practice home care nurse, case managers, meaning, once the patient's discharged, do they need any help at home? Clinical trial nurse, like for clinical trials, like medication trials. Forensic nurse, which forensics means for discussion or debate. Like you're thinking a crime has happened and we're going to have someone come in and investigate. Informatics is more like computer charting, like teaching you about computer charting. Nurse practitioner, telephone triage, utilization review nurse, meaning we're going to examine what's going on with you in the hospital, how long we anticipate your stay there to be. If that stay needs to be extended, we need to know why. If there's another diagnosis going on. And entrepreneur, we said that an entrepreneur was someone that owned their own business. So a nurse could actually open a staffing agency and own her own business. Recommended high school classes, these guys, math, science, English, social studies. You do need a foreign language simply because a lot of our population is Spanish speaking, so we do need to have a Spanish-speaking nurse. It helps. And your health science classes, which is what you're taking now, those are really good to take if you're planning a career in healthcare. Just goes over financial assistance. We're not going to go over that. If you want to learn more about nursing, there are a few websites that you can look at. And make a difference in nursing, make a difference in life. So there's so many different things that you can do in nursing. And along the nursing side, these people are not nurses, but we had to hit this topic, and it's a surgical technician or technologist. And we've already discussed this at some point, but it was on this PowerPoint as well. So that surgical technologist or technician will work under the supervision of a registered nurse in the operating room or the medical doctor that's doing surgery. They can prepare patients for surgery. They set up instruments and equipment. The big thing that a surgical technologist is going to do is assist during surgery. They're going to pass instruments from that surgery table where they've got everything laid out. It might be 100 instruments up there, different types of scissors and retractors and clamps. So they're going to hand, when that surgeon says what he needs, that surgical technician is going to hand them to the surgeon. So he doesn't have to grab anything. He just holds his hand out and they hand it to him, okay? And that's usually a 2-year degree program at a community college, a surgical technician program. And that's it for this PowerPoint.